my understanding of what the current science says about public health concerns from cell phone radiation. It's my conclusion, based on the scientific studies that have been done to date, that exposure to radiofrequency radiation from cell phones constitutes a significant public health hazard, and that it's imperative to take steps to alert the public to find ways to reduce their exposure to these dangers. The evidence that excessive and prolonged use of cell phones is associated with an elevation of cancer is relatively recent. And you've already heard that the latency, that being the period of time between exposure to environmental agents and development of brain cancer, is usually reported as being 20 to 30 years. We didn't use cell phones in the US 20 or 30 years ago. Cell phones were invented in Scandinavia. They've been used in Northern Europe for a much longer time than they have been in this country. The studies that have been done in the US, all studies of people that have used cell phones for brief periods of time, have been negative. The majority of the studies from Europe have demonstrated an elevated risk of brain cancer in adults if they have used cell phones intensively for 10 years or more, but only on the side of the head where they use the cell phones. We're not saying that every brain cancer is due to cell phones, but the story you've heard from Mr. Marks is typical of what we're seeing. Now, of greatest concern is children. And the reason for this is very recent studies published in 2009 from Sweden, where Professor Leonard Hardell looked at the age at which one began to use a cell phone and the risk of developing cancer. What he found, and it's shown on this slide, is that if a person was under the age of 20, the risk of developing a brain cancer was 5 times the risk if they were an adult. And the risk if they were between 20 and 49 was higher than it was if they were older. So this is a particular problem. Every kid in Maine, every kid in the US has a cell phone, and they spend hours on it. And the children and the parents and the teachers and the doctors are not aware of this evidence. We don't say that there's absolute proof at this stage. There needs to be more research. But this is frightening data and suggests the possibility that we may be facing an epidemic of brain cancer as the current adolescents grow to adulthood. Now, unfortunately, the public is unaware of this issue, and appropriate warnings just are not available. Now, there are really 3 ways that we can respond to this. We can do nothing, and we can wait for the body count. That's what happened with smoking and lung cancer. We could impose strict regulation, and that would be totally unwise. It'd be devastating to our economy. It'd be disruptive to all of our lives. I have a cell phone. I use it when I need to, and I use it carefully. The response that makes the most sense is to use common sense, to provide warnings. You can't go to a drugstore and get a medication without getting a whole pile of a list of all the diseases you might get from that. It doesn't say that you're going to get it, and we know that most medications are for good. But there's putting a warning on a cell phone is only responsible. The European Environmental Agency has proposed 4 specific steps. These are: 1, governments, the cell phone industry, and the public should take all reasonable measures to reduce exposures to electromagnetic fields. 2, there should be reconsideration of the scientific basis of the standards that exist, because these standards have limitations. 3, there should be effective labeling and warnings about the potential use of cell phones. And 4, there should be more research and funds to support that research. The state of Maine has a unique opportunity to take a leading role, a role that the federal government is not taking and will not take in the short term, to meet at least 2 of these recommendations: taking reasonable measures and providing warnings. And I thank you, and I hope that you will follow this advice from the European Environment.
Thank you, Dr. Carpenter. Questions? Could you wait a minute? Questions? Representative Campbell.
Thank you, Senator. The FDA states that the weight of scientific evidence has not linked cell phones with any health problems. Do you agree?
I do not agree. That is totally wrong. I don't understand the points of view of some of our federal agencies in light of the evidence. Certainly a lot of this evidence for especially childhood cancer, but also adult cancer, is relatively recent. The arguments that are sometimes used is that we don't get cancer in rats. We don't really care about rats as people, and we have the evidence in people. And that we don't know a mechanism, but you've heard already from other speakers ahead of me, we know that this frequency damages DNA, it causes induction of heat shock proteins. What hasn't been mentioned is it causes induction of genes. So that statement is just not accurate.
The FDA also said that no scientific evidence does not show any danger of use of cell phones or exposure, including children and teenagers. Do you disagree with that?
I vehemently disagree with that. That statement is totally contrary to scientific evidence.
Any other questions? I wanted to ask about the cordless. I saw you had the cordless phone there.
Yes.
And that's probably been used longer and in some ways more prevalent up till recently than cell phones. So you're saying that also is a danger for us?
That is the results from Dr. Hardell. It's not certainly my own personal research. And to my knowledge, he's the only individual that's looked at cordless phones. But he's quite correct that they generate the same radio frequency radiation. It's not over as long a distance, but his results suggest that the elevation in brain cancer is as great as from